Residents of Musina and Limpopo have raised concerns over the influx of foreign nationals admitted to Musina Hospital. Residents were reacting to a recent video where Health MEC Dr. Phophi Ramathuba confronted a Zimbabwean national. The patient was scheduled for surgery at Bela Bela Hospital. Ramathuba told her that she was putting a burden on the country's healthcare system. Let's get some reaction on this. We're now joined via Zoom by health activist Dr. Kgosi Letlape to weigh in on the developments and around Dr. Ramathuba's video and the issues that she raised in that particular video. Dr. Letlape, it's always a pleasure to have you on the show, so thanks for joining us.
Good afternoon to you and to the viewers.
Doctor, I'm assuming by now you've seen that video that has gone viral where Dr. Phophi Ramathuba is making certain utterances to a Zimbabwean national patient. What were your initial thoughts while watching that particular video?
My initial thoughts were that the MEC was raising important issues, but I was quite concerned about the circumstances of where those issues were raised.
Yeah.
Those are not issues that should be raised at a bedside with a patient. Those are political issues that are being raised, and I think the patient should be treated with more compassion than what was shown in the video.
Yeah. I want to talk to those issues that she raised, Dr. Letlape. It seems that she's concerned about the strain on, the medical health facilities in Limpopo. And some have argued, I saw one particular argument being put forward that, there's so much corruption in the sector. Why would you take the opportunity to raise the lack of funds and the fact the lack of infrastructure, whatever you're lacking in the health industry, to foreign nationals? Is that not an issue to be addressed? And also in terms of the corruption in the country that is at the moment obviously something that we're battling with?
I think two wrongs don't make a right. Both issues need to be dealt with and to be dealt with decisively. You can't say because there's another wrong, other wrongs should continue. The issue of corruption should be dealt with, and it should be dealt with by reforming the health system and ensuring that the Department of Health and Health Services are not price takers. They fix prices. But the issue of having porous borders and having a population that you cannot estimate its numbers in terms of the people you serve creates a serious challenge.
Yeah.
Those colleagues that work in the public healthcare system can see the ravages of being overburdened with numbers and with disease. We see frequently South Africans being turned away for treatments because the facilities can't cope. So it is something that needs to be dealt with decisively. What we cannot do is to come up with a compound problem where we say there's corruption. So you can't deal with the issue of people that are accessing our services unlawfully. This has nothing to do with issues of emergency care. We are signatories to international declarations. We have a constitution that we need to uphold. But having said that, it does not mean we have to be negligent about our responsibilities and disregard our responsibilities that those that live within our borders need to access quality services.
So whether or not Dr. Ramathuba raised the issue in the wrong or right platform, the fact of the matter is that she has opened, from what I'm hearing from you, a very important conversation that has to be had. And apart from the conversation, actions that indeed need to take place. And I wonder in what way should those actions take place? I mean, I heard her talking about, while she was talking to the patient, raising Dr. Aaron Muzwaledi's name and saying that this is why he is as harsh as he is. Realistically, though, I mean, it seems that Dr. Aaron Muzwaledi is himself battling with the issue. So where do we begin in approaching this matter?
I think before we get waylaid into the important subjects that the MEC was raising, it should not be understood as though we're condoning the approach that was made. We need to show compassion to patients. And the discussion at that level was above the patient's pay grade. And that discussion is a discussion that our government should be having with other governments in the SADC region, and in particular with the Zimbabwean government. So the way in which the patient was treated was not fair, and patient abuse is rampant in our system. And we need to ensure that those that run the system lead by example in terms of how we need to engage with patients and how we conduct ourselves in front of patients. Even if you raise the issue of payment, it cannot be raised in an abusive manner, in a derogatory manner, or with the belittling of the patient. The patient would still be accountable in terms of our laws for payment of the services rendered. And there are many other issues that need to be unpacked, because in terms of our constitution, there's an obligation. Nobody can be denied emergency treatment. But elective treatments, people should be directed to whence they come from for treatments that are elective, but they should be dealt with humanely.
On that note,
the problems that we have in our health system is the fact that we have a separate system for the poor. And those of us who are privileged are now speaking on behalf of a system we don't use. We don't have skin in the game. The challenges that people from outside and the massive numbers impose on the healthcare system, on the well-being of practitioners, on access to care for South African citizens is something that all of us should take seriously. And we should engage in finding how we solve this problem. People that come here need to be given access to care, but they need to be held accountable for payment of those services.
Yeah. Dr. Letlape, are you of the view or of the belief, as some have said, that Dr. Phophi Ramathuba should face some sort of discipline, punishment for how the matter was raised? I think, we do understand that you're saying that, the issues needed to be addressed, but I think your issue is how, the manner in which the issue was addressed. So are you then of the view that there should be some form of punishment for the doctor, the MEC?
I'm of the view that she was acting in her capacity as a political appointee, as an MEC. The person that is in that position may not necessarily be a doctor, but they got to take account. So there has to be political accountability in terms of how those that are elected into these positions conduct themselves and treat members of society. So at that level, I hope action will be taken. And if there's anybody has any issue with the fact that Dr. Ramathuba is a registered practitioner and that this was a professional act, those matters can then be reported to the relevant statutory body, that being the Health Professions Council of South Africa. But the key issue should be about, she's in a political office and she cannot demean members of society.
All right. Dr. Letlape, it's always a pleasure talking to you. Thank you very much for your input. We appreciate it.
Thank you very much.
All right. That is Dr. Kgosi Letlape weighing in on developments around Dr. Phophi Ramathuba's video and the issues she raised in that particular video, which has indeed gone viral.